Good morning, everyone, and welcome back to day 2.
Woo!
Yep. Can we have a round of applause? What a great start we had yesterday. It was phenomenal, wasn't it? Day 1 really showed the powerful momentum behind Canada's journey to a more connected and patient-centered healthcare system. The focus on interoperability and collaboration was clear across all sessions. But what really stood up was the shared commitment across government, provinces, and industry to break down barriers, drive innovation, and make care more seamless and equitable for Canadians. One of the big takeaways included the critical role of public-private partnerships, policy shifts, and unified data standards in pushing forward the vision for connected care. That announcement of the Interoperability Industry Collaborative Charter, that's going to be a powerful collaboration tool in aligning our nationwide efforts. Wasn't it fascinating to learn from the experts at NHS's One London? I strongly believe that their experience offers us valuable lessons for Canada's path forward. Okay, now let me tell you what's in store for day 2. And trust me, we have an incredible lineup. With 3 session tracks running concurrently, you can tailor your day to your interest. But make sure to check the conference app. It's going to be your best friend for the day. It will help you map out the must-see sessions and their locations. And don't worry about running on empty. We've got snacks during every session break to keep everyone energized and ready for the engaging discussions leading up to lunch at 1:20 p.m. And over to you, Bhavesh.
Thank you, Waldo. Good morning, everyone. We're ready for an exciting day 2. To kick off day 2, to help ground today's discussions in respectful collaboration and lived experience, I would like to welcome to the stage Patient Scholarship winner Risa Mallory and Patient Partner Committee member Ron Beleno. Ron is a retired psychotherapist and patient advocate and partner to numerous organizations, including, Risa is a retired psychotherapist and patient advocate and partner to numerous organizations. Ron and Risa, very similar, ours, including the Canadian Women's Heart Health Alliance, Global Heart Hub, University of Ottawa's Heart Institute, and Canadian Women's Heart Health Centre. Ron is an advocate for dementia, caregiving, aging, and research communities, and is the co-chair of AgeWell's Older Adult and Caregiver Advisory Committee, receiving their Honorary Fellows Award in 2020. He is also an advisor, presenter, and coach for numerous groups across Canada, such as CIHR's Institute of Aging, Healthcare's Excellence Canada, and the Canadian Centre for Caregiving Excellence. Please join me in welcoming to the stage both Risa and Ron. Always a good
Wow, I'm something I'm not. I didn't realize that. But good morning, everyone. So I decided instead of just going paper, I'm going hybrid. I learned from yesterday. So I have 2 that I'm using here. That'll be the fun part. Good morning. Today's day 2 of our Infoway Partnership Conference and Pathways to Progress Advancing Connected Care in Canada. I'm Ron Beleno, a patient partner with Canada Health Infoway from Toronto, Ontario, and I am here this morning to give today's patient opening remarks with Risa Mallory, another patient partner who will share in a few minutes a bit of her journey and some valuable learnings. Yesterday, we had an amazing start to the conference with our 2 patient partners, Anne O'Riordan and Arun Bala, right over there. So, greetings. During the day, we had a patient partner on one of the panel sessions, Terry Price, who sits on Digital Health Interoperability Task Force. And later today, 2 more patient partners will be speaking. Matthew Jackson, Matthew, if you want to stand up very quickly just so they can see your face, from Montreal in concurrent session number 8, Patients Paving the Way, Pathways in Virtual Health. And our closing keynote, Claire Snyman from Vancouver. Hi, Claire. How to put your health in your own hands. What a way to start and close the conference with patients included. One last patient partner we want to recognize, but won't be on stage, is Patient Scholarship Awardee Robin Land. And she's from Airdrie, Alberta, and is with Heartbeats Children's Society. In case we are missing any patient partners who also happen to be here, we acknowledge your time and commitment to joining us. Now, I'm always reminded that people in this community of health and care, without the patient and their challenges, there will be no need for any of us to be here, no need for the work that you are doing, and no need for this conference. We need to always remember that everything we do has to come back in some way to benefit and meaningfully impact the patient and their caregivers. Now, for some of you out there who attended or watched the recording of a first webinar back in September entitled Essential Digital Health for the Underserved, that virtual event was a prelude to this in-person conference. Also, some of you who saw that webinar will likely be asking yourself, is the guy on stage right now speaking to you the same patient partner that spoke at that amazing panel session? The panel session that included Abby Kalra. Abby, are you here? You were here yesterday somewhere. And Morenike Akinyeme from Canada Health Infoway, Ann Chapman from Kai-Hi, and Dr. Kendall Ho from the University of British Columbia. Well, yes, that was me, the patient partner that spoke there as well. I am the patient partner, more specifically the caregiver, to my dad who lived with dementia, Alzheimer's, for over 10 years, until his passing at home in 2018. And I am here again speaking briefly this morning to help warm us up for the day so that we can be better at connecting the dots for better connected care. One of the ways I strongly encourage us to improve connected care is by making sure we also keep improving on how we work with patient partners, their caregivers, and the patient groups that represent them. There are many more patient partners available now out in our communities, looking for opportunities to be part of connected care teams and projects. Please keep finding ways to support them, to be involved with as many of your projects as possible. It will be a great return and a win-win-win for everyone. Today, I am personally looking forward to this upcoming keynote presentation by Annie Martin, who is with the Canadian Space Agency, and will be discussing connecting care from Earth to space. For me, back in the day, some of my university studies were in space and communication sciences. I have always had a keen interest in what is happening with the Canadian Space Agency, and I look forward to hearing how close we are to possibly living the reality of life like Star Trek, where we have a Dr. Beverly Crusher or a Dr. McCoy using computer systems, innovation, and technology from dashboards, tricorders, AI, and even androids like Data to help us with our healthcare data. For those of you who have never watched Star Trek, so I need to kind of ask, who here has not watched Star Trek? Few. That's okay. Just binge watch it this weekend, please. Okay. Then what I just said to you won't make much sense, except that the key points that are my own opinion of successful connected care in the near future will require a combination of extremely knowledgeable and skilled human healthcare experts who understands innovation, digital tools, interoperability, and the fast-moving power of AI, especially to bring connected care to remote and underserved communities. As I finish off, the patient partners would like to acknowledge the wonderful team at Infoway who supported us with coordination and guidance over the past year. Morenike, Rachel Saget, Amelia Kim, Puna Muparelia, and finally Mitchell Nono, who isn't able to join us at this moment because she is due to have a baby soon. So good luck there, Mitchell. Now I'm going to be passing you all to another patient partner who I admire, simply from hearing her journey to be where she is today. I would like to welcome here Risa Mallory, who will continue with our patient opening remarks. Thank you.
Thank you. Thank you. Got my little booster step, otherwise I am literally a talking head behind the podium. And Ron, you may have been in university, but I'm not sure if you're aware that Star Wars first aired in September 1966. I was in Miss Vivian Jones's grade 4 class at Fairfield Public School, and I used to watch the show every day with my glass of milk and brownie by my side. So it kind of ages me. After listening to yesterday's discussions, panels, and presentations, I really had a lot more to add to my talk, but I don't want to overstay my welcome, so I'll stick to my scripted notes here and not bore you to death. I've always been a believer that knowledge is power, and now as I become a community advocate, patient advocate, and patient partner, I've been able to transfer that commitment to my own healthcare. So empowerment in our healthcare is achieved by increasing our ability to manage our own health and our illnesses, increasing a positive health identity, and by that I mean what your health means to you and your sense of self, and increasing our shared decision-making development and contribution to our own healthcare plans, and my personal passion, which is increasing the opportunities that a person with lived experience can enable other individuals, institutions, and policymakers to meet the needs of patients, ensuring that it is truly a collaborative approach. My natural thirst for knowledge and meaning in my life is really a classic case of careful what you wish for. While spending the winter in Arizona in 2018, I presented to the emergency department with chest pain, a family history of premature cardiac death in my mother, elevated cardiac enzymes, and a wonky ECG, and so I was prepared for a very urgent angiogram. During the angiogram, a small dissection was discovered in my left anterior descending artery, and then through the angiogram pressure of the dye or the catheterization, it iatrogenically spread up the LAD into the left main and over to the left circumflex, effectively shutting off all three main left heart arteries for 90 minutes. The diagnosis is spontaneous coronary artery dissection, or SCAD, and what resulted was a 90-minute heart attack or infarct. It was complicated by cardiac arrest, cardiogenic shock. I was put into an induced coma, intubated, and woke up the next morning having no idea how it had turned what typically a 45-minute diagnostic procedure, turned into a 5-hour code blue near-death experience. 6 weeks after discharge from the Phoenix Hospital, I was cleared to fly home to Ottawa, where unfortunately I was, I always want to say incarcerated, that's obviously not the right word. I was admitted into the University of Ottawa Heart Institute for an additional 12 days. I had a lot of time on my hands. I was actually in quarantine, not because of COVID, hadn't happened yet, but because anytime you enter hospital from a foreign country, even if that's the States, you're in a quarantine situation. So I had a lot of time on my hands is the reason I explained that. And my quest for information led me to really research cardiovascular disease generally, cardiovascular disease in women, and SCAD specifically. And there I discovered a program that the University of Ottawa Heart Institute has, which is called the Women at Heart Peer Support Program. And I mention this not because it's digital health, it's not, but because it really was kind of the springboard to my advocacy work and my patient partnering. I was vetted and trained as a facilitator, and I still use that function once a year. I facilitate a 10-session group for, now it's virtual, one of the other benefits of the pandemic, virtual across Canada to any Canadian woman with heart disease. No referral is required, you self-refer, and there's no cost. So if you know anybody in your community, circle of friends, mothers, daughters, whatever, who is a heart patient, they can self-refer to this program, excellent program. What is connected to our discussions yesterday and today is that everybody in the Women at Heart Peer Support Program is automatically enrolled in the virtual care program, the virtual care platform at the University of Ottawa Heart Institute. And that is a wonderful digital platform. It encourages individuals to actively participate in the self-management of their own disease. It provides access to reliable, trusted information, online care in real time through health coaching and remote monitoring, and help to manage heart behaviors, assistance with management of risk factors. So during the last 5 years, networking with patients, patient organizations, and institutions around the world, I now recognize that when it comes to digital health technology, collaboration between patients and partners is paramount importance in order for us both to achieve the mutual results that we want. And so I have a few asks here when it comes to that partnership process. My first ask is to please engage us in meaningful ways. To maximize a patient's engagement, we must be involved beyond making sure that our blood pressure is taken and that our BMI is in the healthy range. Space must be made for our individual goals, needs, desires, abilities, and backgrounds. Please remember that we are more than just a diagnosis. Engage us where we are, not where you wish we were. So most successful health applications need to meet real-life needs of patients as we navigate our very unique healthcare journeys. It's not a one-size-fits-all. And if the application does not solve a problem for us, we're not going to use it. My third ask is to engage us early in the design process. So as I mentioned, apps that do not align their function with our needs won't be adopted. So involving patients early in the design process will result in an end product that we actually will use, as opposed to designing it without us and then asking for our feedback after the fact. This holds true for research too. Please involve us not just as subjects. We like to be called research participants now, so that we don't picture whiskers and a long tail. Engage us in all aspects of research, so including design, methodology, psychometrics, recruitment, and dissemination. A lot of us have huge networks. I have access on Facebook to probably 3,500 women mostly with heart disease, and so use us for that, but engage us first. Engage us, my fourth ask is engage us in progress reports. So genuine engagement is about shifting the historical paradigm of patients as passive recipients to one in which we are full collaborators with a sense of ownership in the results. Keep us informed. I've been involved as a research participant, as a research partner, as a lay reviewer with a national organization, a roundtable participant, a beta tester of an online portal, often not being informed of the progress along the way or the results of my engagement, and that's not okay. My fifth ask is to engage us as equal partners. I also believe, and not everybody agrees with me on this, that patient partners should be compensated for their time. If everyone else around the table is being paid for their time and their expertise, so should patient partners. And my last ask is engage us beyond our stories. Please stop using our stories to raise funds for your initiatives, your research, your clinical programs, if you're not ready to partner with us. Those stories belong to us, and so if you're going to use me, then I want to be involved fully with you. Last year I had rotator cuff surgery on my right shoulder. At the end of September, I had rotator cuff repair surgery on my left shoulder. And I was kept informed and updated about all of my pre, intra, and post-operative instructions through my electronic medical record. Incidentally, I have access to three medical records in Ottawa, three different healthcare institutions. One is the University of Ottawa Heart Institute, and one was right shoulder, and one is left shoulder. My cardiac history was made available, as well as recent blood work, ECGs, and other diagnostic tests to inform the anesthesiology, the surgical, and the discharge teams, and they were a wonderful asset to all of us. But what was very unsettling is, as I read the reports, because I'm very engaged in my own healthcare and I read everything that comes through, I was very unsettled by the fact that my verbal account of my very specific SCAD event was erroneously transcribed by the multiple people and I was asked multiple times. I know a few people have mentioned that the EMR is going to consolidate patient stories. I had to tell my story for this surgery, because this one I don't remember anymore. It's like childbirth. This shoulder here, I probably had to repeat my heart story 3 times. to the anesthesiologist who I saw, to the practical nurse, practice nurse, and to the surgeon himself. So that could be streamlined. But it became a multiple choice exercise now when I read my EMR with regard to my cardiac history. So this is the multiple choice test. My single or double, and maybe you'll remember from my story which one is correct. My single or double or triple, and I read all three in my EMR, spontaneous coronary artery dissection, was in 2008 or 2018 and occurred at the age of 60 or 61 or 62 and resulted in a STEMI or a non-STEMI and was revascularized by 1 or 2 or 3 stents after a period of 60 or 90 or 120 minutes after a total or partial occlusion of 2 or 3 arteries. All of those are in reports from different cardiologists, different anesthesiologists who took my story. And apparently, news to me, I'm allergic to mushrooms. So one takeaway I do want to repeat from yesterday is Luke Redmond, I don't know if he's still here, had a quote that was in a box that I really want to repeat in case you missed it. And the quote, there's no attribution to the quote, but I assume it's a patient, said, "What matters to me is just as important as what is the matter with me." Bears repeating? What matters to me is just as important as what is the matter with me. With that, have a wonderful day too in your ongoing quest for knowledge, and thank you so much for including me on this journey.